Greetings to all the viewers. The topic we are going to discuss about today is morphine, which is an alkaloid. Morphine alkaloids are called natural products, and this is available in injection form here. And the session what we are going to cover will be a powered session. Let's discuss about morphine, which is an alkaloid. Here, morphine is a well-known alkaloid and it is used as an analgesic one. Analgesic means which used to relieve the pains. Pain relieving agents are said to be analgesic agents. So morphine is the best example in that regard. Morphine and overview. Source. Morphine is a natural alkaloid which is extracted from opium poppy. Opium is a plant from which it's a poppy. We are going to extract this one. Its a scientific name is designated as Papaver somniferum. Papaver somniferum is the scientific name for this morphine, and it is the natural alkaloid classification. In what regard this morphine is categorized? Morphine is a opioid analgesic agent. So it is the extraction from opium and used to relieve the pain. So that opioid analgesic agent and meaning it works on the opioid receptors in the brain and a spinal cord to relieve the severe pain. Receptor is the region where the actually pain will be there. Okay, where the actually treatment is required. That particular point is said to be receptor, where this kind of medicines are able to work upon. So that is the reason why this morphine used to work upon brain and the spinal cord related severe pains if present. In that condition, we will go for its treatment. If you observe the composition of this morphine, it is a polyannular system where benzene ring will be there in either saturated cyclohexane, and here the heterocyclic ring with the saturation. This is saturated furan, and in either six-membered ring will be there. This is said to be what piperidine ring means. Six-membered saturated nitrogen is present, piperidine it will be, and it is a tertiary amine will be there. So here in other functional groups, you can clearly notice hydroxy upon benzene, and this hydroxy upon this saturated ring. Okay, so this is the way polyannular system, and phenanthrene skeleton is located in this morphine. So this is the way we can depict the chemical composition for this morphine. And now we will go for uses where we can apply this one. It is primarily used to treat the acute chronic pains. Acute pains are nothing but pains which are triggering and which are severe in nature. At that condition, we will go for the acute pain. Chronic in the sense it is of somewhat critical, still critical pain. So we will go to treat by means of this critical chronic pains by means of this morphine, especially post-surgical pains. After the surgery, that healing process requires larger time. So at that condition, we will experience the pain. So that condition, morphine can be applied. And the cancer related. So in the cancer therapy also, pain relieving, we will go for this morphine as a medication. And pain in the terminally ill patients. Terminally ill patients are nothing but who are since long time they are suffering with the pain. Consistence of pain is there. So that condition also we will apply this morphine. In the structure of the morphine, it's a complex molecular structure. So morphine, if you observe, polyannular system it will be, and a very complicated structure we can clearly observe. So many ring systems are there, and the heteroatoms are there, and the functional groups are located. And here twisting of the molecule and the even stereochemistry, entire molecule is represented as a very complex one. And several ring systems are located, including nitrogen. So nitrogen is the essentiality of alkaloids. So that this nitrogen is essentially present in this alkaloid compound. It is the typical of alkaloids that essential nitrogen is located in this polyannular aromatic system. So this is about the structural representation for this morphine action. It binds a specific receptor. So this morphine, when absorbed when administered. So wherever requirement, wherever suffering with pain, that particular region only it used to bind. That is said to our receptoric site. Receptor is the region where actually drug treatment is required, where the medication is required. That particular region is said to be a receptoric site. Especially morphine works upon brain and spinal cords, and opioid receptoric sites. Opioid receptors means where brain, if any malfunctioning of brain or else any spinal cord related disorders, other condition we will go for this morphine to reduce the sensation of pain. So if that disorder is creating pains, in order to cure them, morphine can be applied. It also causes euphoria. That means if we are using continuously or else higher dosage or else any improper medication without any doctor prescription, proper strategy of optimal dosage forms, other condition it may cause addiction as well. That's the reason why um, both the edges will be there for any kind of treatment, any kind of technology. Both the edges will be there. Both the edges in the sense, same technology can be applied for the well-being, and even same technology can be applied for the destroy. The handling technique, the usage of that one is most important. We need to adopt. So in the same way, this morphine also having a potential medication applications at the same time, and addiction property if we are not properly utilizing. So that is the reason why proper medical description is essential. Structural elucidation. In order to go for that structural elucidation, morphine is a natural product, right? From the plant source we are extracting this one. Whenever we are extracting a crude one, that's subjected to a proper removal of all the unrequired materials from that, and whatever compound is there, that extracted one, we don't know what is the exact chemical composition of that one. So in order to identify step-by-step analysis of its structure, that is called what? Structural elucidation. Identifying the complex structures which are present in that particular alkaloid. That identification or determination is said to be what? Structural elucidation, because it is a natural product, right? Directly we are extracting the juices from plants or else animals. So that after extracting that identification is called structural elucidation. So many methodologies are available. Here we will go for what? Analytical identification methods. So many type of analysis methods are available. First of all, initially, whenever crude product got extracted, first we will go for the chemical composition, what elements are located, that is called elemental analysis. Elemental analysis, if you are subjecting by means of analytical techniques, by instrumental methods, here morphine is having the elements like carbon, hydrogen, nitrogen, and oxygen, and here C17H19NO3 will be the molecular formula for this morphine, and here this chemical composition is deduced by this elemental analysis. And using elemental analysis, how much percentage of carbon is there, how much hydrogen is there, how much nitrogen, how much oxygen, the individual ratios we are identifying. This is the elemental analysis. Next, let's go with the mass spectroscopy. Mass spectroscopy is specially meant for its molecular weight determination. So any compound subjected to mass spectroscopy, its molecular weight deduction is possible, and fragmentation. After the fragmentation, individual parts are subjected to its determination as well. Molecular weight of the morphine is identified as 285.34 gram per mole. Analyzing fragmentation patterns, the presence of specific functional groups can be deduced. As of morphine is a complex one, so we have to go for the strategic fragmentation. A small parts determination is somewhat easy. That's the reason why in the mass spectroscopy, a bulk one molecular weight will be identified and followed by individual fragments also tested for their molecular weight determination. This is a mass spectroscopy is used to identify their molecular weights. And infrared spectroscopy. The purpose of infrared spectroscopy to identify the specific functional groups present in that. And here it used to identify functional groups based on the characteristic vibrations where vibration is there, that vibration responsible for the particular functional group present in that. Using IR spectroscopy, we can identify hydroxy, presence of hydroxy functional group in that. Obviously, morphine is composed with two hydroxy, so that hydroxy functional groups are identified, and we observed CO stretching peak. The CO stretching peak denotes what there is a ketonic functional group. There is a ketone within the molecule, and in its stretching peak is also observed. That means there is a amine group. So this is the way how stretching peak it indicates presence of hydroxyl, and ketonic stretching indicates a ketone will be there, and in its stretching denotes there is amine. This is the way infrared used to identify various functional groups which are located in this morphine. Nuclear magnetic resonance spectroscopy. Proton NMR and C13 NMR spectroscopy have the characteristic in order to identify nature of hydrogen, nature of carbon as well, right? Hydrogen and carbon environments within the molecule can be identified by proton NMR and C13 NMR spectroscopy. NMR spectrum is depicts peaks aromatic protons. Aromatic protons, where can you find aromatic ring? Here is the benzene ring, so that aromatic protons will be identified within the molecule. So benzene ring protons, hydroxyl. So from that data, you can identify there are two hydroxyl groups within the molecule. Alkyl chains. If you observe clearly, here is one alkyl, here is one annular methylene will be there. Here also another CH will be there. They identified these kind of fragments are parts identified by means of nuclear magnetic resonance spectroscopy, NMR. X-ray crystallography. X-ray crystallography means for the three-dimensional structure analysis for the given compounds, and this technique provides the exact 3D structures showing the atoms arranged in a special way. And morphine structure confirmed for 5 rings over there. It is a pentacyclic ring system. Phenanthrene core moiety will be there. Phenanthrene means it's a kind of 2 benzene rings, partially saturated rings will be there. 3 fused rings is present, that is called a phenanthrene core. Nitrogen containing piperidine is also located. Here we can clearly observe piperidine ring over there. Here is the piperidine ring with this methyl. Nitrogen containing piperidine ring is located, a hydroxyl substituted. So we already observed 2 hydroxyl groups are located within the morphine. Now we will go for structure of the morphine. Here is the structure of the morphine. Structure of the morphine, pentacyclic structure is located. Here pentacyclic structure is located. That in this pentacyclic 1, 2, 3, 4, 5, 5 cyclic rings are present over there. Five cyclic rings are present over there. The presence of hydroxyl. Hydroxyl are responsible. Whatever hydroxyl functional groups are present, these hydroxyl are responsible for the polarity for the compound. So if polarity doesn't satisfy, if you are consuming that drug, it will not mix with the fluids which are present within the organisms, within the organs. If it is not mixing with that kind of fluids, that may not work. If it is insoluble, that's the reason why hydroxyl will give the polarity. Polarity used to induce the dissolving tendency for that medicine, right? And this is about hydroxyl. And other than saturated carbon, one is present on the benzene ring, another is present on the saturated, another is present on the saturated 6-membered ring. So the very important part is they used to impart the polarity to the compound. And one methyl group is there, that is at the 17th position on this nitrogen. It is there. This is said to be tertiary amine. in either moiety which is located. And here you can notice the saturated means what? Partially saturated ring will be there. The saturated ring is responsible for its analgesic property. So it used to give pain relieving tendency. Bridged oxygen will be there. This bridged oxygen used to fit the molecule. So that used to fix the molecule. That is the purpose of bridged oxygen. This is the very entire structure activity relationship study it got carried for this morphine. Now let's go for the culture analogy, culture analysis. Aromatic ring. Aromatic ring is present in the, here you can clearly observe, this is the aromatic ring. Aromatic ring contributes to the rigidity to the molecule. Aromatic rings are not supposed to have a normal reaction, rather they are having distinct reaction. Some specific reactions are possible, so that aromatic ring contribute to the rigidity to the molecule. Their reactivity got optimized by means of aromatic ring. Hydroxyl groups make it slightly polar. Due to the presence of hydroxyl, then only the drug solubility in a fluids are possible, then only effective functioning of that drug is possible. And it is also responsible for its hydrogen bonding. It used to bind up with the receptoric side by means of hydrogen bonding, nitrogen atom. And the piperidine ring is essential for morphine's biological activity. So here, heteroatom nitrogen, this is responsible. Nitrogen is responsible for what? It is responsible for the biological activity, whatever it is possessing. The biology, in order to identify the biological activity of this nitrogen, here culture growing is possible, and how it is working with this opioid receptoric sites, that analysis is also carried out. This combination of techniques helped to fully elucidate the complex structure of the morphine and allowed chemists to understand, interact biologically with the receptors in order to relieve the pains, right? So how the entire technique, whatever we applied till this, how complex the molecule morphine will be, and how can we identify that molecule, and what is the distinct roles of the individual, what are the distinct roles of individual functional groups which are present in the molecule. Entire study got covered over there, and this is regarding its structural elucidation. Now we will go for the general approach for morphine synthesis. How can we? Any molecule whichever occurs in the nature in the parallel way, we will go for the synthesis in the laboratory as well. That is only called as a research, right? In the same way, this morphine extracted from the opium poppy, this Papaver somniferum, we can say, and the same manner we will go for another laboratory synthesis as well, so that we will go for analyzing that laboratory synthesis of morphine. And the first approach is set up a retrosynthesis. The synthesis is carried in two ways based on the direction. Based on the direction, we can say normal synthesis denotes what? The starting material, slowly we are upgrading towards the product formation. Retrosynthesis means a reciprocal. Whatever product is there, slowly we are degrading in order to get the starting material, a reverse direction. Right. This is the way retrosynthesis approach is used in order to synthesize this one, where retrosynthesis means whatever complex molecule morphine was taken, that got fragmented, and that used to convert into our various fragments into a simpler one. If you observe the morphine molecule, a strategic fragmentation, we are going to fragment like this, and one of the phenanthrene moiety, phenanthrene fragment got separated, and this is a piperidine ring which is also segregated, and this is of water, this is of saturated furan ring, this is also separated in a particular way. This is the way biological reactivity can be predicted. Sorry, retrosynthesis is applied. Retrosynthesis is applied in order to convert the complex morphine molecule into the individual fragments. Phenanthrene skeletal is a segregated piperidine ring, one kind, and the ether bridge that also used to fragment. So this is the way fragmentation got carried over. And we will go for the important biomimetic synthesis of morphine. This is extracted from the LibreText platform. Biomimetic synthesis means what? Whatever natural synthetic route will be there in the same manner, we are also resembling within the laboratory. Same type of process or strategy will be followed within the laboratory, that is said to be a biomimetic synthesis of morphine. In order to synthesize that, reticulin was taken. Reticulin is the starting material where you can notice benzene ring here, another benzene, and this is a piperidine. Piperidine ring will be there and it is fused with the benzene. This will be a starting material for the synthesis of final morphine. And it will be treated with the mild oxidizing agent manganese dioxide. Whenever manganese dioxide was treated, two hydroxyl groups will be there. Both will be oxidized in order to get double bond O and double bond O. So here double bond O will be generated. This entire molecule kept in a square bracket. Right? Because here ketone is there. Ketone immediately get transformed into enolic form in order to get the higher stability. Obviously, aromatic ring restored with the higher stability. That's the reason why ketonic form immediately transformed into enolic one. If any molecule is very typical to isolate, that is said to be indicated on a square bracket, so that ketonic compound will be transformed into enolic one. This is the way we will get saluteridine. Saluteridine will be obtained over there. After getting this one, next step we are going to treat with sodium borohydrate. The reaction with sodium borohydrate, it is a mild reducing agent. Only the requirement is conversion of ketone into hydroxy. Ketone will be converted into a hydroxy compound which is called saluteridinol. Saluteridinol, right? So this will be obtained. Now it will be treated with another one called pH4. pH4 will be obtained. Phosphorus tetrahydride will be obtained. Whenever it is obtained, ring closure reaction got carried. Ring closure reaction, how can we apply? This is the kind of lone pair of electrons are going to close the ring over here, and this double bond is shifting and the hydroxyl will be eliminated. Finally, we are going to dehydrate the molecule and we are going to get the cyclization reaction as well. So this is the molecule called thebaine. Thebaine itself finds some medical applications as well. And even by converting thebaine into morphine, we are going to get our target molecule called the morphine. How can we convert? Here two methoxy are located. These two methoxy got transformed into hydroxy by means of acid catalyzed hydrolysis. Methoxy can be converted into a hydroxy by acid catalyzed hydrolysis process, so that this molecule called morphine will be obtained. This is the way entire biomimetic synthesis of morphine got possible, and very simple steps we are going to proceed with. Reticulin was taken, initially oxidized, followed by enolized, followed by cyclized, and what we are doing here, reduction process got carried and followed by hydrolysis. This entire process is biomimetic synthesis of morphine. Now, we are at the part called the applications of morphine. Morphine is one of the most widely used opioid analgesic. Significant medical applications, especially in the pain management. In order to manage the pain, this significant applications are recorded for this morphine. Its ability to relieve the severe pains, indispensable in the severe healthcare settings. Very severe pains, if a patient is suffering with, at that condition, morphine is a potential curative agent. Though it also comes with the risk like dependence and addiction. So just now we discussed about proper optimal dosage is very essential, and with the doctor prescription only we have to go with the usage of morphine. Otherwise, it may cause addiction property as well. That's the reason why a careful usage is very essential. And next is about key applications, pain management, acute pain and acute pain and a critical pain, chronic pain. Acute pain denotes what a severe pain. The after the surgery, for example, after the surgery, the patient is used to experience a severe pain, that is a post-surgical pain, we can say. So that kind of acute, very severe pains are used to mitigate it by means of this morphine, and during the childbirth also. So any kind of surgical operations, any kind of injuries, if a patient is suffering with, at that condition, acute pain relieving agent, the morphine will be. A chronic pain. Chronic denotes what it is severe illness and long term illness, and very difficult to go for the curation for that, which is called a chronic pain. Commonly prescribed chronic pain condition, especially in the cancer patients. Cancer patients, that is a chronic disease. At that condition, in order to relieve the pain, we will go for this morphine. And terminal illness. It helps to improve quality of the life, reducing persistent severe pain. So, in order to elevate the life standards and reduce the severe pain conditions, this morphine is very essential. Pain in the myocardial infarction. Myocardial infarction is nothing but any kind of malfunctioning of the heart that used to eradicate cardial pains, any heart blood pumping related problems, any disorders if noticed, at that condition also we can apply this morphine. Management of dyspnea, shortness of breath. If anybody are suffering with a bronchial or pulmonary related breathing problems, at that condition also we will go for this morphine in order to chronic or else any kind of acute pains in that pulmonary related diseases, and it reduces the oxygen demand. So if continuous consumption is, that's why a proper or optimal usage is very essential for this usage of morphine. Pre and post surgical anesthesia. Anesthesia is the drug which used to work upon the functioning of brain and its nervous system. Nervous system, spinal cord will be the central nervous system, peripheral nervous system, and so at that condition, this anesthesia is a drug which used to pass the activity of the brain, activity of the nervous system for some time. How much time we require, that much dosage is required to be consumed in order to make the organs temporarily unconscious. So at that condition, pre and post surgical anesthesia is very essential. Pre anesthesia is nothing but before going for the surgery. After the surgery, in order to relieve the pain, so post surgical anesthesia is also required. Morphine is frequently used part of anesthesia, relieving drug, and during, before, and after the surgeries. It gives before anesthesia. Pre-anesthesia, it will be manage the pains before going to the surgeries, and components of post-operative care at that condition also. We will go for the pre and post-surgical anesthesia. Treatment of pulmonary edema. Edema means what? Swelling. So, by means of fluid consumption, fluid accumulation, if lungs are going to be enlarged, then we can say pulmonary edema. That is called pulmonary edema. In case of acute pulmonary edema, fluid accumulation into the lungs, so that elongation of the lungs are possible, that may cause the disorderness in the breathing system. Morphine is used in a calming effect. Morphine is used for that absorbing the fluids over there, and anxiety can be minimized, and breathing problem will be solved by means of this morphine. It also helps by dilating blood vessels. If blood vessels are elongated, what happens? Blood pumping will become more convenient, so the stress levels and anxiety and pressure will be reduced. Heart and lung functioning will be most common whenever we are consuming this morphine. Opioid agonist therapy. Based on the activity they are doing, all the drugs are categorized into two types, agonism and antagonism. Drug activity is of two types, agonistic activity, antagonistic activity. If I am suffering with any kind of pain, so that the pain, if that pain is reduced, that is called what? Antagonist. Antagonist means it suppress the activity, that pain suppressed. Agonist means if I want to increase my brain activity, so that used to increase, that used to activate the activity, that is called agonistic. Stimulant it will be, right? So if suppressant is there, that is called antagonism. Stimulation is there, that is called agonism. Opioid agonistic therapy. In some countries, morphine used in the place of any other drugs, alternative for any other drugs, because it used to improve the activity, improve, that means stimulate the functioning, and a stimulating therapy will be there. So it is agonistic stimulant, it will be. It is used in emergency medicine. Emergency requirement under trauma condition, any severe injuries are present, or else any burns will be there, any fractures will be there, immediately we require emergency. So at that condition also we can go for the application of this morphine. Relief from the renal colic. Renal means what? Kidney dilation property, kidney dilating system, it will be there. In that kidney related disorders, if we notice at that condition also we can go for renal pain relieving one. So kidney stones are present in order to eradicate this kidney pain, and this morphine is used to relieve that pain also. So this is another kind of application for this morphine. By this, we concluded the entire session, gone through what is morphine actually, what kind of features are present for that one, and what chemical composition will be there, from where we are extracting that one, and what is the strategic elucidation of the entire morphine molecule. And after elucidating its structure, is it possible to go for the laboratory synthesis, laboratory level synthesis of this morphine? That also gone through. And finally, we concluded with its potential applications. Thank you one and all for your patient listening. This is Dr. Kavita Kothiredi Kota, and I'm very much grateful for this session. Thank you.